Today's lecture is on written and electronic communication, professionalism and document preparation, attention to content and presentation of documents, attention to detail. How about positive and effective communication and a reflection of professional image for the office? When you are sending out a document or an email, you are representing the practice, not yourself. So again, let's be professional. Selecting document supplies. Letterhead paper. Used for first page of correspondence, it's either standard or legal size, and it may be embossed for special occasions. Envelopes are business type, typically match the letterhead, and many other sizes are available depending on the function. Labels, convenient for frequently used addresses, and prepared in standardized format called a template. Invoices and statements. Invoice lists product or service for billing statement. So your invoice is, if you send out an invoice to your patients, you can call it a patient statement, the same idea. And the summary of total amounts owed is the statement. So the invoice is the list of the product or service, and the statement is the summary of total amounts owed. It's usually pre-printed, computer generated, and we do call it a super bill or an encounter form. Effective writing, clear and concise language, sweet and to the point. Consider the audience for the tone of your communication. Know the purpose of the letter, the email. Be brief and specific and use simple concepts. Ease and understanding through clarity is a must. Use an active voice. Be polite and courteous, professional again, and double check spelling and numbers. Grammar, no slang or offensive wording. This is not a text to your buddy. Medical office documents and correspondence include parts of a business letter. You have the letterhead. It's usually on pre-printed stationery. You include the date line, which is the month of the day and the year, and then a delivery notation, special or urgent delivery. The inside address, where the letter is being sent, is always included on the first page of the business letter. The attention line for individual emphasis. The salutation, Dear Mr., Dear Miss, Dear Doctor. The subject line, you could use RE, or sometimes there is no subject line. If you're sending off a note to a supplier who hasn't fulfilled everything, RE, supply order from December 1st, 2019. We wondered when these back orders will be filled. That's your subject line. Body is the main part of the message. The complimentary closing is usually sincerely or with respect, respectfully or with regard. And the signature block is the writer's name and address. The identification line and notations are used for reference. We have different letter formats and styles. We have full block style. This is the most common type of keying that is there. It is a full block letter style typed with all lines flushed to the left of the paper. Now your modified block style has a date line, a complimentary closing, and signature block at the center of the page. Modified block style with indented paragraphs is another type, and the simplified style, the simplified letter style modifies a full block style by leaving off the salutation and the complimentary closing. So the simplified style does not have a Dear Sir and respectfully yours. That's the difference. How about punctuation styles? There's open and mixed, depending on what's needed. And in inter-office memoranda or memos. And headings are standardized by the office, and it may be done as an email secondary to technology advances. Memo, remember today we are having the office is closed from 12 to 2 for holiday luncheon today. That would be a memo. Written communication using electronic format. Now, electronic media and email to patients are protected by HIPAA laws. And assigned consent is needed for patient portal communication. So the patient has to sign on to the patient portal, but before they can do that, they have to go to the receptionist and sign a form that says they agree to patient portal communication. We have inter-office emails and we have managing emails. But again, When you are at work, the emails being sent are not to and from best friends and buddies. Please be professional in your correspondence. Editing and proofreading. I cannot stress how strong editing and proofreading needs to be done. Editing, check for accuracy of facts. Does this letter flow in a logical manner? Is it as concise and clear and to the point? And does it have a professional, positive tone? Proofreading, check for grammar, spelling, and formatting errors by using spelling grammar check. Every Word computer that has Microsoft Word, you can click on review or preview, and you can do grammar and spell check. Tools for editing and proofreading. We use dictionaries, medical dictionaries and English dictionaries, language dictionaries. We use a thesaurus. These are online. English Grammar and Sage Manual. Again, grammar is usually online. And word processing spell checker, as I mentioned, is used in the Microsoft Word program. Addition process. Language usage. Is it formal versus informal? All correspondence to patients is done in a formal manner. Content. Is it clear, concise, and to the point? You're not going on and on and on and on and on and on. Is the style appropriate to the reader? Proofreading. Again, look for formatting errors, look for data errors, and mechanical errors. Make sure that thing is correct before you send it out. The one thing I see in correspondence I receive from a lot of professionals is incorrectly spelled words and grammar problems. Signing letters for preparing outgoing mail. Now, as this is going to be put in an envelope and mailed, has it been signed by the practitioner or the provider or the person who needs to sign it? Are you using a letter folding and inserting machine? If not, please know how to fold a letter and how to prepare the envelope, because we have the optical character readers used by the United States Postal Service to speed mail processing. So address, placement, format, and zip codes are important, that they can be legibly read by the OCRs. Mailing options. So we have mailing equipment and supplies, airmail supplies. We have envelopes for overnight delivery service. And we have postal rates and scales and meters in our office. Posting mail. Is it an envelope or a package? Does it have appropriate postage? And is it placed in the designated area for pickup? U.S. Postal Service delivery. These are the rules for the different classes of regular mail. First class, 11 ounces or less. Second class is for newspapers and magazines. Third class is media mail for printed material. Books. Fourth class is parcel post for packages from 1 to 70 pounds, and the rate depends on the weight and the distance. We have special services for additional fees like overnight, 2-day, or 3-day express. You can also use messengers and couriers to deliver your packages the same day. Processing incoming mail. Who processes the incoming mail? Usually the practice manager. We'll sort and open the mail, and we'll look through the mail and prioritize it. Personal confidential mail is usually left unopened, and they take care of everything else. Recording. Is there a daily log with responses noted? Annotating is to underline or highlight key points and to attach the patient chart to the letter, if need be. And then you need to distribute it to appropriate locations. The magazines and coloring books go to the reception area. The practitioners' things go on their desk. If there's common information for all the MAs, there's an MA spot where those things go. Test results that have come through the mail, who gets them first, the RN or the doctor. So the practice manager will sort through and take care of allocation. Handling drug and product samples. You need to follow the office policy. And that ends our lecture today on written and electronic communication.